Hi, I'm Dr. Sabrina Shah-Desai, an aesthetic oculoplastic surgeon based in London on Harley Street. Now, if you've decided to book in to have your eyelid surgery with me, then whether you're having an upper eyelid blepharoplasty, also known as an eyelid lift, or a lower lid blepharoplasty known as eye bag surgery, droopy eyelid or ptosis surgery, or for that matter any other eyelid or brow surgical procedure, it's important to understand the recovery process and the aftercare so that we are well informed and support you through your journey. Now, after the consultation, we give you a detailed information sheet which explains to you the different steps that are involved before you even come in for your scheduled surgery. And this starts 2 weeks before the surgical procedure, where you have to avoid aspirin, ibuprofen, Nurofen, common blood thinning agents, and supplements like ginseng, garlic, etc., because this will make you bleed and more prone to bruising. So therefore you want to come in, you want to stop this, and there is a detailed list in the paperwork we give you at least 14 days before surgery. We also advise you to stop smoking. Now, if you're a smoker, you need to stop for a minimum 2 weeks before and for 6 weeks after surgery, as smoking adversely affects your healing. If you have a medical condition like diabetes or high blood pressure, this also slows down your healing process. So this is obviously going to affect how you heal, and you need to make sure you're taking all your routine medications appropriately and controlling your medical conditions, your diabetes, the blood pressure adequately before you come in for surgery. So this is the worst bit. You've had your surgery, and this is how you come out looking, from the operating theatre. Of course, I've just used my lovely therapist Diana to model how you come out. And on the right is how you'll come out after having an upper eyelid surgery, whether it's ptosis or blepharoplasty. On the left is from a lower lid blepharoplasty. So as you can see that although you walk in to the hospital, you do need some help to get home, and you need somebody to look after you at night after you've had the treatment, because there will be an antibiotic ointment in your eye, your lids will be swollen, and this combination will blur your vision. And when you come out with this dressing, which sometimes can also be blood stained, and tears can be, you can have watery eyes and tears can be dripping down from the side. All of this then impacts your vision. So it's really good for somebody to look after you that night at home and to pick you up after surgery. So that night when you get home, all we want you to do is rest and apply some ice on your eyelids. Now, you can use some frozen peas in a clean Ziploc bag, or you can use an over-the-counter sports ice pack. Make sure it's not too cold, as it will cause stinging, and just gently close your eyes. Put a clean cloth between the ice and your operated eyelid and lay the ice for 30 minutes, 3 times in the evening, for 30 minutes each time on the night of surgery. The night of surgery, you just want to sleep propped up, a bit like Diana is propped up now, if you can, on a couple of pillows, and you just want to take it easy. Now, we've already put the antibiotic ointment in your eye, so remember your vision is going to be blurred. You don't need to put anything in your eye. You don't need to use the eye drops we've sent you home with. So I'm going to tell you what happens when you wake up the next morning. So obviously the lids will be really swollen and the vision will be blurred. So the first thing that you do is take the tape off. Now I'm going to show you, you obviously clean your hands and you gently take this tape off, and with it comes off this little gauze. It might be a little blood stained. This is for your upper eyelid blepharoplasty. I'm going to come to lower lid blepharoplasty in a second. Now you see these little white tapes, these are called steri-strips. These stay in place, you don't take them off. If they happen to fall off, don't try to stick them back on again, and you will see a scar line underneath, which I'll explain how you clean. But essentially, you just clean your eyelid with boiled, cooled water. You can use one of the sterile saline sachets, which you can get at a pharmacy, with sterile gauze, or you can use a tissue a clean tissue which you have dipped in this boiled cooled water, and you gently dab. So the other thing you can do is use a clean cotton bud and dip it so that it's soaking wet in the boiled cooled water or the sterile saline, and you can gently roll it over the steri strip to clean. And this is really one of the key ways you clean the eyelid. Okay, so once you've cleaned the eyelid, remember we've given you an aftercare pack. Now what does your aftercare pack contain? It contains a lubricant eye drop which you put 2 to 4 times a day. It also contains an antibiotic ointment which, remember, we have already put in your eye, but you're going to need to put in your eye. So the way you use the drops is you use the drops in the daytime 2 to 4 times a day, and you use the antibiotic ointment at night, and you need to put the antibiotic ointment on the wound and in the eye. So I'm going to demonstrate to you how you can do this. So you've got your antibiotic ointment. This is a sealed antibiotic ointment. Remember, the seal is going to be broken because we've already used it in your eye. And then you take the antibiotic ointment out, just squidge a little onto your clean cotton bud, and then dab it with the cotton bud on the steri strip. Okay, now in the night, you're going to need to put a little bit inside the eye, and I'll show you that right at the end of the video. Now this is what you do for the first 3 days. On day 3, you gently peel off this steri strip, and when you peel it off, you'll see the scar line underneath, which can look wrinkled, crepey, scabby. It doesn't look pretty at this stage, but that's because the lid is healing. So this is your immediate aftercare, and you carry on doing this. So drops 2 to 4 times a day in your eye, antibiotic ointment on the scar line. Once the steri strips are off, remember you can use the antibiotic ointment on the scar line, and then you take a little bit and put it inside the eye. Now I'm not going to put any in Deanna's eye, but you literally just put it in at the inner corner like this, and it goes inside the eye, but it will blur your vision. So I advise you to put it last thing at night before you go to bed. Now, if you've had an lower lid blepharoplasty, then that's what you'll look like the next day. A lower lid blepharoplasty will leave you very swollen, the vision will be very blurred. So the next day, you gently take off this outer dressing, and you will see that you've got a sticky little semi-colloidal dressing called duoderm, which is skin color. Now, to take off the duoderm, we don't need to wax it off. So just open your eye for me and turn your head this way. You just pull the skin firmly and then gently take this off. Now you can see when I take it off, some of the steri strip comes off. That's absolutely fine. Don't try to stick this steri strip back on. So we take this dressing off, leave the steri strips on. You basically clean it like you would the upper lid blepharoplasty, boiled cooled water, and using the lubricant drops 2 to 4 times a day in the antibiotic ointment at night. And on day 3, after the surgery, you gently take off whatever remaining steri strips are there, and then you clean the wound again, and you're applying your antibiotic ointment on the wound. And remember, a cotton bud is great for actually gently dabbing it on the wound. Now, one of the commonest questions I get asked by all patients is how much pressure should we apply? We're scared to touch our eyelids. And you really want to dab it clean. You want to make sure that you're keeping the skin clean. You don't want to pick on any scabs. So minor oozing blood will, come out in a clean line on the swab when you use a cotton bud that you've wet. So you remember you need to wet it. But if you've got scabs that are, sitting quite tight and firmly on the eyelid, then you want to use your gauze or your tissue soaking wet with clean saline or boiled cooled water, and place it on the eyelid for a good 5 minutes to soak the scabs, so that then when you wipe clean the eyelid, either with a cotton bud or that gauze piece, the scabs fall off naturally. So you really want to encourage the scabs to fall off naturally, and you don't want to pick on the scabs. Now, the wound can look weird. As I said, it can look, wrinkled, crepey. You may have little split opens. wound, you might have a bit of oozing. This is all entirely normal. Please don't judge my handiwork and my suturing skills at such an early stage. It does take time for the wound to heal, and typically you'll start seeing the scar go through a phase which, you know, in the first 4 weeks it's an inflammatory phase, and then it starts getting little red and more inflamed and thickened and tight, so it's a contractile phase and you feel as if the eyelids are tight, and then it goes through a relaxation remodeling stage where it starts looking more like your normal skin. Typically I would see you between 7 and 10 days to take the stitches out, but my team keep in touch with you all through the post-surgical procedure. So from day one, we are available on an emergency phone number which we give you, so it's part of your little recovery kit. So remember, we give you this at the time of surgery, and although you get detailed information, you have a ready reckoner which you can keep by your bedside with an emergency phone number that is only handled out of hours, and a very quick guide that you or your family member or friend can read and assist you to look after the eyelids. So the next day after your surgery, we want you to send us pictures so that we can monitor how you're doing, and we stay in touch with you all through, and then I see you at the first week and take the stitches off. The other question I get asked a lot is, when can I start using makeup? We don't advise you to use makeup. We do sell a makeup foundation, which is a mineral makeup foundation with an SPF that we can color match you for, and the cost currently is £55, and of course you can apply that in very small quantities on the scar. Most people pick this up after the stitch removal at week 1 because then it's your SPF come camouflage makeup that allows you to become socially, allows you to socially integrate faster. And then the other question is, what happens once the antibiotic ointment, which is to be used for 2 weeks, and the lubricant drops, which are typically to be used for 2 weeks, are done? Well, for the scar healing, we advise you to use an eye serum with growth factors, which really downregulates the redness and inflammatory component of the scar, and you just use it like a normal eye cream morning and evening, followed by either the camouflage makeup foundation, which has the SPF, or your own SPF. Sunglasses, which are UVA and B protective, are your friend. And then at night we tell you to put a silicone based gel dressing called Kilocoat gel, which you can buy online, Superdrug, Boots, etc. at any pharmacy, and you just apply it on the scar line, making sure it doesn't go into the eye every night to flatten the scar. Some patients like using it morning, evening, but I find around the eye area it can irritate the eye, so I just tell patients to use it at night. You can always massage the scar. Bio oil is great for massaging the scar. We also have a pre and post supplement that we advise. It's called SkinAid MD, which reduces downtime and improves healing, but also equally you could take arnica and a bromelain or eat fresh pineapple. That will be anti-inflammatory and help you recover faster. So that's about it in a nutshell, your pre and post surgical video guide. Of course, we give you lots more written information that is really detailed, and I encourage you to read it and read it again, because sometimes it can be quite confusing for you as to what's happening when. And please remember, my team is always available. We are at hand to help you and support you through your pre and post surgical journey. Thank you so much.